How can a country with such economic power not care about the people who built it up to what it is today? Well, the United States is starting to show that it cares with Obamacare. We'd like to thank Congressman Jim Hines for inviting the Agency for Health and Research Quality to present a proposal. We chose to address this to you because of your past activity promoting healthcare, and more specifically, Obamacare. Historically, the insurance industry has been a private for-profit industry. It has been unregulated and unfair. It has been prone to rate hiking and refusal of service based off of prior injury. This means that those who could afford the high premiums had access to treatment, while those who could not had no treatment at all, or only access to expensive emergency room visits. The Agency for Health and Research Quality is committed to improving healthcare by developing partnerships with others interested in quality, safety, effectiveness, and efficiency. We aim to reduce risk of harm during treatment, fund clinics with the best equipment and training possible, and transform research into practice. The Patient Protection and Affordability Act, more commonly known as Obamacare, was signed into action on March 23, 2010. Its goal is to provide quality, affordable care to all citizens. It operates under the Health Insurance Exchange. The Health Insurance Exchange takes the private for-profit industry and puts it into a competitive market. This competitive market is then placed on the internet, where citizens, such as me, can view the different prices for premiums and different packages that I could receive. It promotes quality over quantity, meaning that the quality of treatment that doctors provide is more important than the quantity of patients treated. It also has no out-of-pocket preventative costs. Obamacare costs about $1.1 trillion over 10 years. Through these 10 years, our national debt will decrease by $143 billion. It is paid for on a sliding scale tax system and through government funding. The sliding scale tax system means that those who have higher salaries will pay a higher percentage, about 2.5%, and those who have lower salaries will pay a lower percentage, about 1% to 1.5%, depending on their situation. As taxes and government funding will then be used for scholarships, for healthcare services, and for funding for current clinics.
Since Obamacare was enacted, issues have arisen concerning private healthcare premiums. Data released shows that the private market premiums will increase as much as 169% as a result of the creation of this highly competitive social healthcare market. Those who seek healthcare through the common market will receive significantly lower premiums and treatment prices. This is an unexpected backlash for those who already have insurance and were guaranteed protection of the current enrollment status. It was originally promised that premiums for private industries would decrease or stay the same. However, further research has revealed that insurance companies will be hard-pressed to offer reasonable private care rates. In addition to these discrepancies that we were told between the price of private and public health care, states are running behind implementing Obamacare. With the Health Insurance Exchange happening in 2014, that's a mere 4 months away, states are running behind. These states, 34 states, are actually refusing to create or operate their own exchanges, stating that it is the sole responsibility of the federal government. And on top of that, of the states' refusal, many Republican seats within the House of Representatives and the Senate have expressed a firm dislike of the program. With a lack of support from Congress, states definitely will not choose to implement this on schedule. And also there's the issue that some states are actually providing an opt-out option for their lowest income residents. These offerings show that they are actually, when offering this, the states are not stating to their lowest incomes that the federal government will cover 100% of the bills for the first year, and then 90% of the bill from every year thereafter, where the citizen only has to pay 10%. This tactic is is shown to break down Obamacare by the states and will leave 2 to 3 million low-income Americans without coverage. This just can't stand. These American citizens need to be covered with insurance.
My name is Sungyoon Jang, and let me introduce healthcare system in South Korea. South Korea has national health insurance, which is mandatory enrollment. There are two kinds of insurances in national health insurance: citizen health insurance and regional health insurance. For the citizen health insurance, people pay about 3% of their salary. On the other hand, regional health insurance is formula-based. The difference between these two health insurances depends on the salary. The salary for the people who are enrolled in citizen health insurance is easy for government to figure it out. It means that government can easily know how much people earn as a salary. On the other hand, salary for the people who are enrolled in regional health insurance is hard for government to figure it out. For example, the government can't get a precise salary data for a farmer because the farmer may hide his or her salary to lower their tax. If people in regional health insurance do not hide their salary, both healthcare systems will work very well. However, there is one more main problem in regional health insurance. The formula which the government uses to determine the amount paid for regional health is unclear. This leads to unclear tax amounts and prevents fair trial to lower the required fee. Maintaining both private and public insurance is extremely expensive for citizens to make a payment. Therefore, South Korea's health insurance is an excellent program because citizens in need can find high-quality treatment at an affordable price. People do not have to pay for private health insurance. If the formula used for determining the regional health insurance fee is clear, and if people do not hide their actual salary, the healthcare system will be fair and successful.
Canada's healthcare program is a prepaid plan called Medicare. This ensures all eligible residents to obtain the basic medical needs. The Canada Health Act regulates Medicare, where its goal is to protect, promote, and restore the physical and mental well-being of residents of Canada by having reasonable access to health services with financial or other barriers, meaning patients will not be directly charged during time of appointment, which is fantastic because no one wants to pay in general, or at least wants to pay extra money out of pocket. Medicare is not under one nation where it's controlling everything, but it is dividing into 13 tutorial programs which all falls under the basic standards of coverage and common features set by the Canadian Health Act. By dividing the programs, the nation can decide the funding for each territory. Medicare covers the basic needs, however, it does not cover eyewear or cosmetics. Residents of Canada have the option to buy private insurance as a premium. Private insurance is expensive, but they do cover more than Medicare, and you do not need to make an appointment 3 months ahead into the future. Because seriously, how are you going to remember what day and what month and where you're going to go in 3 months? Seriously? It is said that the poorest Canadian lives the same lifespan as the average American who's in the middle class. That's saying something. What Obamacare can take from this is having the state regulate the health plan under one act or guidance, just like Canada Health Act, and having private insurance as a premium added on to the universal healthcare coverage, making Americans live longer. Because care plus people equals happy, healthy people.
The Patient Protection Affordable Health Care Act indicates a strong intention to improve the living standards of all Americans. Previous healthcare systems catered to those of wealth, denying the less fortunate and forcing treatment to become a luxury, causing the ERs to be massive for these people who didn't have health insurance. And they would go there and spend all of their money on these incredible medical procedure bills. The Agency for Healthcare Quality and Research proposes to encompass ideas from some international countries. They're looking at their policies to place and assist the reform of Obamacare when the time comes. Taking into consideration the pros and cons of these countries, the United States can become the top global contender for quality and affordable health care. The effective principles to consider from South Korea include mandatory enrollment in the national insurance system and percent-based taxation. These practices guarantee a set premium cost for health care and provides a clear number each citizen will pay. In South Korea, all income families pay about 3% of their salary for high quality, anytime access to treatment. Taking in a sliding scale tax as are a struggle for high income citizens to accept because of the belief that they worked hard for their money. Operating under the percent-based taxation would mean low-income families will contribute the same ratio of their income as high-income families. It is important to remember that no life is valued above any others. Creating a fair system of payment will encourage the fair system of treatment. And taking from Canada, they have a public and private healthcare systems to operate in a cohesive unit. All citizens are automatically enrolled in the public healthcare program. There is an additional option to then engage in an upgrade for private healthcare that covers more treatments and higher percentages of out-of-pocket costs. The issue, however, is that the public healthcare are excessive wait times due to the lack of available clinics and medical professionals and physical capital. The United States can take from the basic system and improve upon an override possibility of exuberantly high private healthcare premiums. The United States is set up. We already have plenty of doctors, plenty of medical equipment, plenty of clinical locations. All we would need is that the social health care. By automatically enrolling citizens in the public health care, premiums for those not seeking private insurance will remain affordable. Federally regulating the private health insurance as an upgrade program that would offer greater coverage of treatment. Treatments would prevent private premiums from skyrocketing. In addition to this, the taxation system can be split into two costs: maintaining the public healthcare programs with low rates and funding clinics, medical programs, and physical capital. Though this investment, excessive wait times for public healthcare, through this investment, excessive wait times for public healthcare can be avoided. All these countries have federally guided healthcare systems. The United States needs this because the states are fighting back. The federal government must enforce the policies it wants to put in place because the states are fighting back. Such as South Korea and Canada, the federally ran systems work. The reliability of the federal government as opposed to our current situations of the states being at fault but blaming the federal government for its failings. In order to assist the Patient Protection and Affordable Health Care Act in best serving the nation, the current issues need to be addressed. Our agency, was created to improve the quality, safety, efficiency, and effectiveness of healthcare for all Americans. Through the observation of international social health system, a team was compiled in the beginning of a document of viable solutions. You in the House can take this into consideration when reforming the Act.
So, in conclusion, repealing Obamacare will cost millions of dollars, and it's just too much for the U.S. to handle right now. And we must come up with a better solution to be able to fix this problem, but still keep everybody happy. So, what we need to do is work with what we have. So, in able to do that, we must change, modify, and do whatever is needed to Obamacare to satisfy people and be a better option for the United States and all of its citizens. Taking a look at the other countries' healthcare systems, like Australia, Canada, and South Korea, and other countries that have universal healthcare, and seeing what works for them and what doesn't work for them, and being able to take what does work for them, incorporate it into our plan, and be able to come up with the best possible solution will be something we'll be able to do and incorporate into the U.S. plan to be able to change Obamacare and see what is needed to it. And although Obamacare currently has an oversight committee built into it, right now it's not really working. The oversight committee needs to know what is going on, what is wrong, in order to change it, make it better, make Obamacare the best possible healthcare solution for the United States. So what we ask you to do, Jim Hines, is to bring us the problems so we can come up with solutions as the agency Health for Research Quality and able to come up with solutions to fix this and bring them back to you so then you can bring them back to the House of Representatives and be able to fix this problem, be able to come up with the best possible solution for the United States healthcare. So we do ask you to attend our meeting on September 26th to further discuss all of this, answer any questions you have, see what we can do for you, see what you can do for us, and be able to fix this, be able to come up with the best possible solution for the U.S. So we will have one of our members contact you within the next couple of days to set up a time, set up everything, and be able to figure that all out. So if you have any questions at all, feel free to contact us before then. If not, one of our members will be contacting you very shortly. Thank you again for listening to us today and be able to bring our proposal to you. We very appreciate it, and I hope you have a great rest of your day. Thank you so much.